Hi, how you doing? My name is Brandon Simeon, and I am about to assess a patient that has a knee injury. So this is for school. So my scenario is you are, meaning me, examining a athlete who was playing soccer. When I witnessed the injury, I noticed that her foot was firmly planted and that she appeared to twist her knee while an opponent made contact against its lateral aspect. I note immediate swelling, and the athlete is complaining of severe pain and tenderness along the proximal tibia. She also reports hearing a pop at the time of the injury. So it's given the mechanism observed and these initial findings, what injury might I suspect? So I suspect that since she was hit against the lateral aspect, that she might have a lateral cruciate ligament injury, or she might have, or a proximal cruciate ligament injury. So what I'm gonna do first is ask the patient's history. So have you ever injured that knee or that leg before?
No.
You haven't. Okay, what about the other knee or other leg?
No.
Okay, so the patient is not having any history of injuries in any leg, so there's no discrepancies. And do you play any other sports?
No.
So soccer is the only sport, so all the patient does is play soccer. All right, so what I'm gonna do first is observation. So I'm gonna observe the leg and note if I see any swelling or redness that's different than the non-hurt leg. And now I'm gonna do the palpation part and feel around, see if there's any tenderness. Do you feel any pain when I touch?
Yes.
You do. So the patient is showing signs of tenderness in the knee. And there's probably a little swelling compared to this leg. This leg feels a lot skinnier. And then, so now I will start with the special test. So I will start with the active range of motion. So first, I'm gonna have you lay on your back. All right. Now bring the heel of your foot to your butt. Is that as far as you could go?
Yeah.
Okay. Now lay it back down. Now do the same with the other leg. So the patient was able to easily pick this one up and not this one. All right, so next. All right, so next I will test to see if the patient can extend the leg even more. So by doing that, she'll have to flex her quad. So can you flex your quad? As hard as you can. Flex your quad muscle.
What's this crazy go?
All right, now flex this one. All right, so by doing that, what I would want to see is the leg rise off the table a little bit, which this one didn't because it's a knee injury. And then next, I'll ask you to sit down. Can you turn around and sit down? Now, can you fully extend your leg? Now, can you bring your leg back down? Now, fully extend that leg. All right, bring it back down. All right. Now we will get the see the internal and external rotation of the tibia. So by doing that, I want you to turn your leg inward. Can you turn your leg inward?
Like.
Okay, can you turn it outward? Okay. Now that was for the active range of motion. Now I will perform these again doing passive range of motion. So okay. So now far back I could bend it. Do the same with the other leg. Alright. Now, can you sit down for me again? Sit down. I'll see if I can fully extend the leg. Okay, those two. And fully extend the leg. She shows signs of pain in this leg, which is the injured leg. Okay, and now I will take the leg, and then I will still see the external rotation of the tibia. So I will turn this inward. Okay, go outward. All right. Okay. And now the third test I will do will be the resistive range of motion. So now what I'm gonna ask you to do is, with this leg, I want you to try to extend it while I push on it, while I stop you.
Oh, Lord.
So try to extend it. Is that as hard as you could go?
Yeah.
Okay, stop. Now I'm gonna try to do it inward. I'll try to contract. Okay. Now same with this leg. Can you extend it?
Yep.
Patience a lot stronger in this leg. Can you pull it in? Good job, good job. Okay. So now I'm done doing the range of motions. Now I will go into the special tests. So I will start off with the anterior joint test. This will test to see if the ACL is injured. So by doing that, I will take the patient's leg. Can you actually turn and lay on the table for me? Okay. So by doing the anterior joint test, I'll take the patient's leg and pull towards me, and the leg stayed in place. If the leg moved, that means the ACL will be ripped or torn. And then now I will do the Lacrimosa test. I don't know how to pronounce it, but I will take the leg and I will pull it towards me. And the leg was intact. And the next test I would do would be the PCL to test the posterior joint. So with this test, instead of pulling outward towards me, I will push inward. Okay, and now I will do the posterior sag test. So what I want you to do, pick your leg up like this, and now I will let go of the patient's leg and see if the leg could stay in place. Okay. There was slight movement there. This leg was easier able to stay in place. The next test I will conduct will test the MCL, which is the medial collateral ligament. So, by doing this, I'll have the patient pick her leg up. Then I'll try to push the knee outwards. She stays in place. And then to test the lateral collateral ligament, I'll do the same thing, but pushing the leg inward. And that it stayed in place. And I'll do the same with this one. Medial will be pushing it outward. Lateral, pushing it inward. And then the next test I will do will be testing for the meniscus. by doing this, I'll pick the leg up and I'll apply force to the knee with one hand and twist the leg outward. A rotational force. And then the last test that I will conduct, I will have the patient lay on her side.
It's not hurt.
Well, actually, lay on your stomach. And this is called the athlete's test. So I have the patient pick her leg up. And then I will start twisting to see if there's any unusual movement at the knee joint. And now the last test will be to test the IT band. So now lay on your side for me. By testing the IT band, I will ask the patient to lift your leg up and hold it. If the leg sags, that means the IT band is injured. And you go to the other side. You can do it. Which this is the injured leg. And that concludes my assessment.